So here we are going to discuss about the cerebral palsy. Particularly, we are going to focus pathophysiology, sign and symptom, diagnostic test, treatment, and nursing care plan. So cerebral palsy, it is a neurological problem or disorder that affect the body movement and muscle coordination. So a disorder characterized by impaired movement and posture resulting from an abnormality in extrapyramidal or pyramidal motor system. So let me recap it. I said cerebral palsy, a group of disorder that affect the movement, muscle tone, balance, or posture, right? And the most common clinical type is septic cerebral palsy, which is represent an upper motor neuron type of muscle weakness. And less common type of cerebral palsy are attenuated or ataxic or mixed type. Attenuated, it means a condition in which abnormal muscle contraction causes involuntary movement, and it affects some people with a cerebral palsy. And ataxic or atetics means the loss of full control of bodily movement. So some people has a loss of full body movement, and some people abnormal muscle contraction who has cerebral palsy. So the basic pathophysiology, abnormal intrauterine development of the brain or hypoxic trauma injury damage the cerebral cortex and impaired the motor function. So this is the underlying cause of cerebral palsy. What are the signs and symptoms or data collection? Extreme irritabilities and crying, feeding difficulties, abnormal motor performance. What else? Altered the muscle tone or stiff and rigid arms and legs. So you see the rigid and stiff, abnormal curvature, delayed developmental milestone. Also, persistence, the primitive infantile reflexes after 6 months. So the baby who have Moro reflex, tonic neck reflex, it is okay before 6 months. If it is persist even after 6 months, it is abnormal. And most primitive reflex disappear by 3 to 4 months of age. Abnormal posturing, right? Like I said, opistonic posture, exaggerated arching of the back, this one. Also, seizure may occur. So most common sign symptom is ataxia, septicity, muscle weakness, impaired gait, swallow problem, speech problem, visual problem, hearing difficulties, sometimes tremor, reflex abnormalities, intellectual disabilities, and seizure. So when we need to talk about the seizure, definitely every healthcare provider needs to know how to take care of the seizure patient. So seizure precursor is very important, like ped side rail, also oxygen suction machine, always equipment at the bedside, monitor the serum level of any kind of antipsychotic medication. So if patient have a seizure, during seizure, always lower the patient to bed or floor at the standing or sitting level. So it is important. Also turn the patient to the side. It is every patient, healthcare provider should know. What else? What are the intervention? The goal of the management are early recognized and intervention to maximize the child abilities. A multidisciplinary team approach is implemented to meet the many needs of the child. Therapeutic management include physical therapy, occupational therapy, speech therapy, education, and recreation is important. So in this flowchart, we can see what are the management and treatment. So before management, I want to tell you how we diagnose it. Definitely ultrasound or CAT scan or MRI. The treatment, basically, some doctor prescribe botulinum toxic or intrathecal baclofen or PTOT. Speech therapy can work like medication, anticholinergic, anticonvulsant, antidepressant, anti-inflammatory medication, or muscle relaxant is work. Speech therapy, okay, physical, occupational, speech language, right, behavioral therapy, and also assisted living. What does it mean? They need some special equipment, assistive device, or orthopedic surgery can help. Okay, it is called baclofen insertion or gastroenterology or hearing correction, orthopedics or pulmonary vision need to correction. Okay. An alternative, sometimes animal assist therapy, nutrition, yoga, adaptive sports can help. What next? Determine the child development level and intelligence, means IQ, encourage the early intervention, and participation of the school program is encouraged. Prepare the using mobilizing device to help the prevent or reduce the deformities. Encourage the communication and interaction with the child on his or her developmental age level rather than his or her chronological age level. Provide a safe environment by removing sharp objects using a protective helmet if the child falls frequently, or implementing seizure precursor. Provide safe, appropriate toy for the child age and developmental level. Position the child upright after the meal. Medication may be prescribed to relieve the muscle spasm, which cause intense pain. Also, anti-seizure medication may also be prescribed. Provide parents with information about the disorder and treatment plan. Also, encourage the supportive group for the parents. So, nursing care, we provide safe environment is the first priority. Monitor for any kind of aspiration, airway check is important. Also, have the suction equipment always be ready. So,